Hello, my name is Joe Hammond. I'm the Quality Assurance and Training Manager with Stat Ambulance located in Columbus, Indiana. I'd like to take this opportunity to welcome you to our brand new web training. This training is designed to be a guide to the basic EMT in performing their skills. I ask that each of you, whether you work directly for Stat Ambulance, another service, or just simply going through a basic EMT class, that you take a few minutes and view this skill as practice for what you're going to be doing in your career. Stat EMTs, once you have watched this video, I will be coming around to your respective stations to watch you perform this skill. All others that view the skill and want to practice or be signed off for your service, please give me a call at area code 812-379-9111, and I'll be more than happy to meet with you and assist you in this process. Today's skill station will be airway, oxygen, and ventilation skills, which will include upper airway adjuncts and suction. For the suction portion of this video, I will be utilizing our brand new DeVilbiss portable suction unit, which is unique in the fact that it has a one-way filter that eliminates bacteria from reaching the patient. This filter is to be changed every 2 months, and since it is a one-way filter, it is imperative that it be inserted properly for the suction unit to work. As with all skill stations, and anytime you are caring for a patient, your first thing you must do is body substance isolation, or BSI. So you must take BSI with all skill stations. Your first step is going to be the OP Airway. And first and foremost, you must measure the airway for proper insertion and fit of the patient. The OP Airway, otherwise known as oropharyngeal airway, is used to keep the tongue from occluding the airway. This must be inserted in the patient without a gag reflex. So if the patient does have a gag reflex, an MP airway must be used. You're going to measure the patient from the corner of the mouth back to the lobe of the ear. Once you have obtained the right properly sized OP airway, you insert it in an inverted or upside down manner until you're about halfway in. Once you've reached the halfway portion, rotate the OP airway 180 degrees and it will continue to move into the proper position. For this skill station, once you have inserted the OP airway, the patient begins to gag and is not tolerating the OP airway, the examiner will ask you to remove the OP airway. The next step of this skill station is to be portable suction. And again, you've already taken BSI, so it need not be repeated for this skill station. Again, we're going to be using the DeVilbiss portable suction unit with the one-way filter, and I will show you how it is properly assembled with the filter, with the tubing, and with the anchor tip to complete the suctioning. Your examiner will now inform you that you need to insert a nasopharyngeal or NP airway. The first step in this process is to select the appropriately sized NP airway. You do this by measuring from the tip of the patient's nose down to the earlobe. You then apply a small amount of water-soluble lubricant to the tip of the NP airway. The NP airway is then inserted in the larger of the two nares with the bevel facing towards the septum. It must be inserted correctly and all the way. With the OP airway, you're going to first measure the device for the patient. You're going to do that by measuring from the tip of the corner of the mouth down to the earlobe. When you insert the OP airway, it's inserted inverted or upside down. Once you have it inserted approximately halfway, rotate the device 180 degrees and it will continue to occlude the tongue and fall into place. Your examiner will now inform you that your patient is gagging and you need to remove the OP airway. This is completed by just pulling the OP airway straight out. Your examiner will now inform you need to suction the patient. Again, we're going to be using our portable suction device with the one-way filter. The one-way filter is clearly marked with out and in. The outside goes directly to the device itself. The inside goes to the suction unit. You then select your tubing, your suction tubing, and it plugs in to your suction device. Turn your power on, occlude the suction, and verify that you have 200 millimeters of mercury of suction pressure. Then insert your yanker tip. You will notice on top of the yanker tip is a hole. With the suction unit open, no suction is applied. Once you occlude this hole, suction is then being provided for the patient. You insert into the patient mouth with no suction applied. Then you occlude the hole, and with a sweeping motion back and forth in the patient's mouth, withdraw the anchor tip. Never suction for any longer than 5 to 10 seconds. You have now completed the skill station, and I will be coming around to see you all very soon, and I wish you the best of luck. Thank you.